All right, jumping right into this deep dive. We're talking postpartum nursing care. Pretty important stuff, right, for new families and for you, as future nurses. So we've got excerpts here, straight from a fundamental nursing textbook. And listen, we know, textbooks, they can be a bit dry.
Yeah.
But we're here to make it fun. We're going to pull out the good stuff, the must-knows, make it all come alive.
What I think is so fascinating about postpartum care is it's more than just the physical. It's not just, are you healing okay? It's physical, it's emotional, it's the social transition. For the mom, of course, but for the whole family.
Okay, so it's bigger than just checking things off a list. It's about, the whole experience, right?
Exactly. And that's where, this is where it gets kind of interesting. The textbook, they actually use this acronym, BLEE, to guide postpartum assessments.
BLEE. Okay, that sounds a little, bubbly, maybe, for something so serious. So what's it actually stand for?
So each letter, it represents a key assessment area. You've got B for breasts, U for uterus, B for bladder, another B for bowels. Then there's L for lochia, E for episiotomy or perineum or epidural site. Then another E for extremities. And the final E, that's for emotional status.
I see. Okay. Well, it's a little silly sounding, but I guess it is a pretty good way to remember everything. So let's unpack a few of these. Let's start with, the bladder. Seems straightforward enough, right? But I'm guessing there's more to it than meets the eye when we're talking about, postpartum.
You're totally right. You would think full bladder, no big deal. But after delivery, a full bladder, that can actually displace the uterus.
Really?
Yeah. And then it can't contract properly. And that can lead to, this is the serious part, postpartum hemorrhage.
Okay, yeah. Big deal. That puts it into perspective for sure. So you're saying a simple assessment, like just checking the bladder, can have a huge impact.
Exactly. That's why this whole BLEE thing, it's pretty helpful, actually. It makes sure that, even when things are super busy, and they always are postpartum, that we don't miss those critical assessments.
What about lochia? I remember that term, but I got to be honest, it's a bit fuzzy.
Oh, lochia. So that's just the vaginal discharge after childbirth. The important thing is assessing it. What color is it? How much is there? What's the odor? All that tells you a lot about how mom is recovering.
Okay, so foul odor could be an infection.
Exactly. Or heavy bleeding could be another problem.
Like you're a detective.
Yeah.
Right. Taking all these little observations and you're putting the puzzle together of mom's health.
I like that. That's a great way to think about it. And then, of course, we can't forget about the emotional side of things. That's what that last E in BLEE is all about.
The textbook mentioned this postpartum blues, right? Is that just like the baby blues? Or is it something, more serious?
Well, that's a really important distinction to make. Baby blues, that's pretty common. It usually goes away in a couple of weeks. But postpartum blues, sometimes that can be a sign that something else is going on, something like, postpartum depression.
So what should we be looking for? What are some signs that it might be more than just, the baby blues?
So you want to look for mood swings, for sure. Tearfulness, irritability, anxiety, and if they have trouble sleeping. If any of that lasts longer than a couple weeks after the baby's born, that's definitely something to pay close attention to. Those are signs that we might need to do a further assessment or even, a referral.
It seems like providing emotional support is so important, but also knowing when to, escalate things when it might be more serious.
You got it. And that's where you, as a nurse, that's where you come in. You're not just there for the physical stuff. You're caring for the whole person.
The textbook also mentioned cultural considerations. And some of those practices, I got to tell you, I'd never even heard of, like taping silver dollars over the baby's belly button.
Right. It just shows you how diverse these beliefs and practices can be. As nurses, we've got to be aware of those differences. And we've got to approach care, with sensitivity, with cultural humility.
So what does that look like, practically speaking? What can we actually do?
Well, it starts with really listening to our patients, try to understand their beliefs, their preferences, and just be respectful of their traditions, even if they're different from our own. Oh, and we can't forget about language barriers. We've got to make sure we're communicating clearly that everyone understands.
Right, because you can't assume everyone's going to approach postpartum care the same way. You got to meet people where they are.
Absolutely. It's all about individualizing care, meeting the needs of each family.
Speaking of families, I was really interested in how the textbook distinguished between bonding and attachment. What's the difference there?
So bonding, that's like that initial, almost instinctive connection between a parent and baby. It usually happens right away, right after birth. It's like boom, this surge of love and protectiveness. But attachment, that takes time. It's a deeper bond that develops as they interact and respond to each other.
So bonding is like the spark, and attachment is the flame that grows.
I like that. That's a perfect analogy.
Now, is there anything that can get in the way of that attachment? Anything that makes it harder?
Yeah, definitely. If there's a premature birth or the delivery is difficult or there are complications after birth, all that can kind of interrupt those early interactions between a parent and baby. And, sometimes that can impact how that attachment develops.
So how can nurses help, especially in those tough situations? How can we help families bond and attach?
One of the best things is skin-to-skin contact, encouraging that right after birth whenever possible, and, promoting breastfeeding if mom's interested, and just helping parents learn to read their baby's cues. It's all about building that connection, that responsiveness between parent and child.
It's like you're balancing the mom's physical recovery with that really critical parent-infant bond.
Exactly. And again, it reminds us that every postpartum experience is different. There's no one right way to do things.
Okay, let's talk about something that can be kind of controversial. Breastfeeding versus bottle feeding. What's the textbook's take on that?
The book really stresses supporting informed choice. It talks about all the benefits of breastfeeding, which are great, of course, but it also gets that it's not always possible or even the best option for every family.
So it's not about pushing one over the other. It's about giving families the information and letting them decide what's best for their situation.
Exactly. And that might mean providing support for both, breastfeeding and bottle feeding.
Okay, so what happens when it's time to go home? What are some of the key things families need to know to, make it through those first few days and weeks?
When it comes to sending them home, it's all about equipping them with the knowledge and the resources they'll need, so they can, thrive once they're out of the hospital.
So what kinds of things are we talking about specifically?
Okay, so think practical skills. Diapering, bathing, umbilical cord care, recognizing if their newborn is sick, that kind of thing.
Yeah, I remember learning all that stuff. And it's a lot. It's a lot to take in when you're a brand new parent.
Oh, for sure. But that's why we break it down for them. We keep the language simple and clear. The goal is for them to feel like, okay, we got this, not overwhelmed.
Right. And I know safe sleep is a big deal, right?
Huge.
Yeah.
We're really emphasizing that back to sleep message. Babies on their backs, a safe sleep environment, nothing in the crib, no loose blankets, toys, all that. It's all about reducing the risk of SIDs and creating good habits right from the start.
It makes you realize these little babies, they come with a lot of responsibility.
Yeah.
What about resources? Like once they're home, I can imagine things could get, lonely sometimes.
Oh, absolutely. And that's where, we can step in and really make a difference. We can get them in touch with lactation consultants, postpartum support groups. There are a ton of community resources out there, even home visiting programs. There's a whole network of support. We want families to know it's there.
It really does take a village, right?
It really does. And speaking of the village, let's talk about adjusting as a family. A new baby, it affects everyone. So we need to address not just mom's needs, but the whole family's well-being.
So it's not just about the physical stuff, it's also emotional. Like the whole family is adjusting, figuring out their new roles.
Exactly. And those adjustments, they can be tough. So we want to encourage them to communicate, to talk to each other, to find ways to manage their stress. And we can address any concerns they have about, things like sibling rivalry.
Oh, yeah. Sibling rivalry. Any tips for that?
One thing that helps is involving older siblings in taking care of the baby, even little things, and setting aside some time just for them, one-on-one. It's important to remember, too, that it's totally normal for siblings to have all kinds of feelings about the new baby. They might be jealous or excited or confused. It's all part of it.
Sounds like a lot of patience and understanding is needed. Maybe a little humor, too.
You got it. A little laughter goes a long way. And really, that's what postpartum nursing is all about. You're supporting families, you're giving them information, you're connecting them with resources, you're helping them through this huge life change. It's challenging, it's rewarding, it's incredible.
I feel like we've just scratched the surface here, but that's a good place to pause. We'll be back soon for part 2 of this postpartum deep dive.
Welcome back. Ready for more on postpartum care.
You bet. Last time we were talking about the BBLEE acronym. That's pretty helpful, right? For guiding those postpartum assessments.
Oh, it's a great tool. It makes sure you're hitting all the important stuff.
For sure. So let's zoom in on a couple of those. What about the uterus? I remember learning about uterine involution, but could you refresh my memory? What exactly is that again?
Okay, so uterine involution, basically it's the uterus going back to its normal size and position, before pregnancy. After delivery, the uterus is pretty big, like grapefruit sized. It's got to shrink back down, and that can take a few weeks.
So how do we actually, check on that?
We palpate the fundus. That's the top part of the uterus. We're feeling to see if it's firm, if it's soft, or what they call boggy. That could be a problem. And we track where it is, like how far down it is from the belly button. It should be a little lower each day as the uterus shrinks.
Right, and we measure that in finger breadths, right? Like 2 finger breadths below the umbilicus. Crazy how much the body changes, during pregnancy and then postpartum.
Yeah, it really is amazing. And speaking of changes, let's talk about the emotional side of things. We touched on postpartum blues, but what about, more serious stuff like postpartum depression? As nursing students, that's something we really got to be ready for.
Oh, absolutely. I've been thinking about that a lot, actually.
Yeah.
What are the signs, the key signs and symptoms of postpartum depression?
Right.
What should we really be watching out for?
So the baby blues, that's more like mood swings, tearfulness, and it usually goes away pretty quick, like within a couple of weeks. But postpartum depression, that's more intense and it lasts longer. It's like constant sadness, anxiety, maybe they feel worthless or guilty. They lose interest in things they used to enjoy. Their appetite changes. Sleep is messed up. They can't focus. Sometimes there are even thoughts of hurting themselves or even the baby.
Whoa. Okay, those are serious red flags.
Right.
And it's so important to remember that it can happen to anyone, right? Like any new mom. Doesn't matter, what her background is or if it's her first baby or not.
Exactly. And that's the problem. There's still so much stigma. People don't want to talk about it. It makes it hard for women to get help. But it's a real medical condition. It needs treatment, just like any other illness.
So what can we do? Like if we think a mom might be struggling with postpartum depression, what's the first step?
Honestly, just listen. Create a space where she feels safe, not judged. Let her know you're there for her, that you care.
Yeah.
And encourage her to talk to her doctor, her midwife, whoever, about how she's feeling.
Right. It's not about us diagnosing. It's about, seeing those signs, those symptoms, and encouraging her to get the help she needs.
Yeah, exactly. And, something I think is really important, and we touched on this before, but cultural sensitivity is just so crucial, especially postpartum.
Yeah, you're right. We talked about it briefly, but I think it's worth digging into a bit more. Can you give us some examples? Like, how might cultural beliefs affect postpartum care?
Okay, so think about this. In some cultures, after the baby's born, the mom stays in bed, like for days, even weeks. It's called confinement. They believe that rest is really important for recovery. But in other cultures, they want moms up and moving around right away.
Wow, that's so interesting. I remember the textbook talked about food, too. Different beliefs about what to eat.
Yeah, certain foods might be considered, like, good for recovery or for breastfeeding.
Right.
Or bad. Like, some cultures focus on warm foods to restore balance. Others avoid certain cold foods. It really varies.
It goes to show you got to ask, right? You can't assume you know. Every family is different. You have to respect that.
Absolutely. It's all about meeting them where they are, incorporating their beliefs and values into their care plan.
Okay, let's switch gears for a minute.
Yeah.
Let's talk about comfort measures. Childbirth, that's no walk in the park. And then postpartum, well, there's a whole new set of discomforts to deal with.
It's true. We tend to focus so much on the baby that we forget, mom's body's been through a lot.
Right. So what are some of the common things we might be dealing with? What are some of those discomforts?
Well, pain is a big one. Pain from the episiotomy or tears or even after pains, those uterine contractions that happen as the uterus shrinks.
Ouch. After pains. Those sound pretty intense.
They can be. Then there's breast engorgement. As the milk comes in, that can be really uncomfortable. And, constipation and hemorrhoids, those are common too.
It's like on top of everything else, your body's still healing. So what can we do? How can we help moms manage all that?
Pain management is key. We can give them pain medication, of course, if it's ordered. Ice packs, sitz baths, those can help too. And just encouraging them to change positions, keep moving a little. Good posture is important too, to minimize strain.
And making sure they know how to take care of their perineum.
Absolutely. Keeping it clean and dry, that'll help it heal and prevent infections.
What about breast engorgement? Anything specific for, breastfeeding moms versus those who aren't?
So for breastfeeding moms, frequent feedings, that's key. Making sure the baby's latching on correctly, that's really important too. That helps drain the breasts, prevent engorgement. We can also teach them how to express milk manually or use a pump if they need to. If they're not breastfeeding, then it's more about suppressing lactation. So things like a supportive bra, ice packs. and avoiding breast stimulation.
So it sounds like there's a lot we could do to help moms feel more comfortable. And of course, emotional support, that's got to be just as important,
Yeah.
right? Especially during this time.
Oh, for sure. Sometimes just listening, offering a few kind words, that can make a world of difference.
Okay, now let's talk about getting moving, encouraging physical activity. I remember in class, they said it's really important to get up and moving postpartum.
Yeah.
But what's realistic? What should we be telling moms?
The key is to take it slow. Start gradually. Listen to your body. Walking is a great way to start. And then as they feel stronger, they can add other things like gentle stretching, low-impact exercises.
So no marathons right away.
Probably not a good idea, but even a little bit of movement, it makes a big difference, both physically and mentally.
What about those Kegel exercises? I know those are important, but why?
Kegels, those are fantastic for the pelvic floor muscles. Those muscles get weakened during pregnancy and childbirth, so Kegels help strengthen them.
Right, so it helps with bladder control, which I know is a common issue postpartum. Anything else?
Oh, yeah. Strong pelvic floor muscles can help with constipation, too. And even, down the road, contribute to a better sex life.
Wow, so it's not just about, preventing accidents.
Exactly. And don't forget the mental and emotional benefits. Exercise, it can really boost your mood, relieve stress, and that's something all new moms need.
I love that it has those benefits, too. Okay, now, let's talk about something that can be a little, awkward maybe.
Yeah.
Sexuality and contraception after childbirth. It's important, but it's not always easy to talk about.
You're telling me a lot of new parents, they're hesitant to even bring it up, but we need to talk about it.
So what are some of the challenges couples might face? What kinds of things are we talking about?
Well, first of all, there's the physical recovery. It takes time for a woman's body to heal. And, hormones are changing. That can affect libido, too.
And let's be real, they're exhausted, sleep deprived, not exactly romantic.
So true. And emotionally, there are challenges, too. Body image, worrying about pain during intercourse, that kind of thing.
So how can we, as nurses, help couples through all this?
It all comes down to communication. Creating that space where they feel comfortable asking questions, talking about their concerns. We can talk about the changes they're going through, give them some tips for managing discomfort, and clear up any, misconceptions they might have.
What about, when is it okay to have sex again?
Most doctors will say to wait until after that postpartum checkup, usually around 6 weeks after the baby's born. But really, it's up to the couple. They need to decide what feels right for them.
And of course, we got to talk about contraception too.
Definitely. That's a conversation to have before they start having sex again, to prevent another pregnancy.
So what are the main things to think about when we're talking to couples about contraception? What are the key considerations?
Well, are they breastfeeding? What's mom's overall health like? What are her preferences? And then we have to consider the effectiveness of different methods, the side effects. There are so many options these days. The goal is to help them find what works best for them.
Right. It's not one size fits all. Okay, before we move on, let's talk about nutrition. What about mom's diet?
Oh, that's so important too. For recovery, whether she's breastfeeding or not.
So what should we be telling moms? What's the main message?
Just eat healthy. A balanced diet, fruits, vegetables, whole grains, lean protein, that kind of thing.
What about calories? I know a lot of moms are worried about losing the baby weight.
Yeah, I get that. But it's important to listen to your body. Eat when you're hungry. Don't crash diet, especially if you're breastfeeding. Losing weight gradually, that's the best way.
And stay hydrated.
Oh, absolutely. Especially if they're breastfeeding. They need to drink tons of fluids to make milk.
Wow. So much to remember.
Yeah.
I feel like we've covered a ton of ground in this part of our deep dive.
We have. We've talked about some key assessments, how to manage those common postpartum discomforts, cultural sensitivity, that awkward conversation about sex and contraception, and we even touched on nutrition.
I feel like I've learned so much already.
Me too. And we're not done yet. Stay tuned, because in part 3, we're going to dive into that final stage of postpartum care. We'll be talking all about sending moms and babies home, discharge planning, how families adjust, all the things that help set them up for success.
Okay, so we're back. It's really amazing how much we've already covered,
Yeah.
When it comes to postpartum nursing care.
It really is. I mean, there's just so much to it, right? Physical assessments, emotional stuff, cultural differences, all of it.
And now in this last part, we're going to focus on discharge planning. That transition, getting moms and babies ready to go home.
Yeah, that can be a really, exciting time for families, but overwhelming too, right? So it's our job as nurses to make that whole transition as smooth as possible.
So where do we even start? What are the key things we need to think about when we're planning for discharge?
Well, even before we think about sending them home, we got to make sure mom's recovery is going well. So we check her vitals, look at her lochia, make sure she's peeing okay, and watch those incisions.
So we're basically making sure there's no infection, no complications, nothing that could cause problems once she's home.
Exactly. And we can't forget about breastfeeding. Lots of moms have questions, they're nervous whether they're breastfeeding or not, so we got to provide support there too.
What kind of support specifically?
For the breastfeeding moms, we check how baby's latching on, help with positioning, and talk about any concerns they have, like milk supply or if it hurts. And for bottle feeding moms, we go over how to prepare the formula, how to feed safely.
So everyone feels confident, ready to go, no matter what they choose.
That's the goal. It's about giving them the tools, the information, so they can feel good about taking care of their baby at home.
Okay, so besides feeding, what else is on that discharge planning checklist? What are the essentials?
Oh, man, so much. We go over all the basics like diapering, bathing, how to care for the umbilical cord, how to tell if the baby's sick.
I remember learning all that stuff. It's a lot to take in for new parents.
It really is. But that's why we got to break it down for them. Simple language, small steps, make them feel like, okay, we can do this.
Right, and safe sleep, that's a big one too, right?
Huge. Back to sleep. That's the message. Babies on their backs, safe crib, no blankets, no toys, nothing extra in there. It's all about reducing the risk of SIIs.
It's kind of scary, how much responsibility comes with these tiny babies.
It is. And once they're home, it can be tough. So we want to make sure families know about all the resources that are out there. Lactation consultants, support groups, all kinds of community resources, even home visiting programs.
It really does take a village.
Doesn't it? Okay, and speaking of the village, let's talk about how the whole family adjusts. I mean, a new baby changes everything, right? So it's not just about mom, it's about everyone.
That's so true. It's a huge adjustment. Emotionally, socially, the whole family dynamic shifts.
And sometimes it's hard, so we want to encourage good communication between partners. Help them recognize when they're stressed and figure out how to manage that. And, talk about things like sibling rivalry, all the stuff that comes with a new baby.
Sibling rivalry, that's a whole other topic. Any tips for that?
One thing that can help is to get the older siblings involved. Let them help with the baby. And, set aside some special time just for them. Oh, and it's important to remember, it's totally normal for siblings to have all kinds of feelings about the new baby. They might be jealous, they might be excited, they might be confused. It's all part of it.
So lots of patience, right?
Definitely. And a little humor never hurts. In the end, that's really what postpartum nursing is all about. It's supporting families, giving them information, resources, helping them through this massive change. It's tough, but it's amazing. It's incredible to be a part of it.
Wow. It really has been a deep dive. We've covered so much, from those first assessments to sending them home, everything in between. It's clear that nurses, they play such a vital role in all of this.
I agree. And to all you future nurses out there listening, I hope this has given you a better understanding of what postpartum care is all about. It's challenging, for sure, but it's so rewarding.
It's been great chatting with you, breaking it all down.
Yep.
And to our listeners, thank you so much for joining us on the deep dive. We'll catch you next time for another deep dive into the world of healthcare.